My name is Lucy Aquino, Chief Executive Officer of Hispanocare, Inc., a program of Advocate Illinois Masonic Medical Center and affiliated with Gottlieb Memorial in Melrose Park. This afternoon, you are watching a live interactive talk show brought to you by CAN Cable 21, and during the next 25 minutes, we'll be discussing stroke. Very important topic. We invite you to call in with any questions that you may have. The number's at the bottom of your screen. Area code 312-738-1060. Our phone lines are now open. Joining me today is Dr. Raina Gupta, neurologist with the Advocate Medical Group over at Illinois Masonic Medical Center. Allow me to welcome you and thank you for being on the show.
Thank you for having me.
Well, a lot of things to talk about today. Such an important topic that affects all of us. So, Dr. Gupta, in the United States, stroke is the fourth leading cause of death, killing over 133,000 people each year, and a leading cause of serious long-term adult disability. Now, it's also estimated that over 700,000 stroke survivors in the U.S. over the age of 20, which is pretty young.
Very much.
And approximately 795,000 strokes will occur this year, one occurring every 40 seconds and taking a life approximately every 4 minutes. Stroke can happen to anyone at any time, regardless of race, sex, or age. So the big question is here, Dr. Gupta, what is a stroke?
So a stroke is defined as a sudden interruption of blood flow in the blood vessels in the brain, or it can be defined as bleeding into the brain that spills over into the surrounding tissues. There are two main forms of stroke, the first being ischemic stroke, which is lack of blood flow, which occurs in about 2/3 of stroke patients. The other form is hemorrhagic stroke, which is a bleeding stroke, which occurs in about 1/3 of patients.
So a lot of times people confuse, I hear this often, that a stroke is associated with or is a heart attack, and indeed it's not. So our viewers, what would you tell them about those two things?
So a heart attack is a blockage in the blood vessels of the heart, but a stroke is a blockage in the blood vessels of the brain. And you can see in this picture of the blood vessels of the brain, oftentimes you'll have strokes in the major blood vessels of the brain, but they all come from the heart. And the problem that's happening in the blood vessels is actually occurring in all of the blood vessels of the body, in the heart, including the brain. And you can see that cholesterol plaques can build up. So the same disease process that happens in the heart can happen in the brain, but they're completely different entities.
Oh, well, and you can see, as we can see, it's all related to plaque.
Yes.
Which is what we really have to work hard on, all right? So what does a stroke look like? I mean, someone's having a stroke or you're having symptoms of a stroke, but what does an actual stroke look like?
A stroke can look like sudden numbness, sudden weakness, sudden difficulty speaking, sudden difficulty with coordination, sudden alteration of mental status. One of the tools we use to evaluate a patient that you think might be having a stroke is called FAST. Stands for FAST, F-A-S-T, which F stands for face. So we want you to evaluate their face to see if there's any weakness of the face or if the face is symmetric. A stands for arms. You want to have them hold their arms up in the air to see if there's any weakness in the arms. S stands for speech. You want to have them speak or evaluate their speech, see if they can repeat after you. And T stands for time, meaning that time is of the essence in a stroke and that somebody needs to call 911 to have the patient evaluated in an emergency department if you feel that they're having signs or symptoms of a stroke.
Now, we talked about the face. Obviously, we're talking about a face that actually could change from one side to the other. It's usually opposite of left and right.
Yes, so the face, you can have weakness on one side or the other, and especially people that know the patient or family members that can tell that there's a difference means that the patient's having some new symptoms.
Right. And you also mentioned the arms too. So if they're raising their arms and they can raise one but not the other,
right?
You know, it's not about trying to get them raised to both, but the fact that they can't raise one but could raise one and not the other.
Right, because weakness usually only occurs on half of the body or one side of the body.
Now you obviously mentioned 911. So vital, so important. And enough of our community members who come across these symptoms, emergency symptoms that need urgent care, tend not to call 911.
Yes, and that's the big problem. We want to be able to intervene on these patients and treat them because the interventions we have the potential to improve their symptoms or reduce their stroke symptoms. But the key really is to have the patient come in immediately. So immediate evaluation is really necessary. And it's our job to educate the community and every patient that we see to educate their own community to recognize the signs and symptoms of stroke and to be able to act immediately.
So Dr. Gupta, stroke can affect anyone, but as with any illness or disease, and a set risk factors usually predisposes you to a stroke. So who gets a stroke?
So there is a lot of risk factors for stroke, actually. There's some that we can change, and there's some that we can't change. The risk factors that we can't change include family history, age, sex, and previous stroke or heart attack. If you do have a family member, a mother, father, brother, sister that's had a stroke in the past, you have a higher potential for having a stroke or a higher risk for having a stroke. As we age, our risk for stroke goes up. And in terms of sex, more men than women have strokes annually. And then if you have ever had a previous heart attack or previous stroke, your risk of stroke in the future increases. Now, there are also risk factors that we can change that are modifiable risk factors. These need to be evaluated by a physician who can determine treatment options for these. And these include high blood pressure, high cholesterol, obesity, smoking, coronary artery disease, carotid artery disease, atrial fibrillation, obstructive sleep apnea, excessive alcohol use, illicit drug use, obesity, and physical inactivity.
All these things. And when we think about not just the alcohol consumption, but the smoking, and then we have the epidemic of obesity. I mean, these are all things that, like anything else, it's going to affect us, regardless of whether it's heart disease, diabetes, or anything else.
Definitely.
All tied in. When you start looking at all this, you start looking at the same symptoms and the same causes that can really prevent all these other things as well. So, okay, so let's say, not that I want to be, but let's say that I am experiencing what I think might be a stroke. So when I go to the emergency room, what happens in the ER? I mean, a lot of times folks do not go to the emergency room because they're afraid of what may happen during procedures or processes. They're just afraid of what's going to be done to them because, we do watch a lot of television.
Yeah.
But seriously, what really happens in an emergency room once you come in with the signs of a stroke?
So usually patients are evaluated very quickly, and this includes a number of things. So you'll be seen by a nurse or an ER physician. Usually there is some blood work that's done. Vital signs will take your blood pressure, your temperature, your weight. And we'll also check a CT scan of the brain, which is just a picture of the brain to help us understand if there's a stroke, if there's a bleeding stroke like we talked about earlier, or a lack of blood flow stroke, and when it occurred. You may also be seen by a neurologist who can help evaluate you and determine if you're a candidate for intervention.
I want to remind our viewers again that today's topic is the one that's very important. Not only that May is Heart Month, but we are also talking about this in particular because there's just not enough happening with follow-up. There's not enough happening to calling 911. A lot of individuals will wait until this last possible moment. Earlier today, I actually had an individual, former friend actually, that stopped by, and was telling me about what her husband had experienced, and that most recently he was doing some heavy lifting, and that he's maybe 125 pounds, a little guy, not very heavy at all, but he was doing some lifting, had complained about a little bit of chest pain, but thought that it was due to the heavy lifting. And so it was ignored for a couple of days, but the pain kept coming, and eventually went to the emergency room only because a friend of his told him, just like shoveling snow sometimes, and you're doing these heavy things that you're normally not used to, you could have a blockage. Right. So his friend obviously scared him. He went to the emergency room, and it turned out he not only had one blockage, but he had two. life-saving.
Yes.
Who knows how much longer if he had not followed up.
Right.
So
it's very common for people to wait and to see if their symptoms improve on their own or sleep on it and see how they feel the next day. But really, our push is for community awareness, for people to come in immediately and to understand why, because we really do have the potential to improve the stroke, but we only have a few hours to do that. And after that window is passed, medicine so far has not found any further treatments to reverse a stroke after about 8 hours.
Oh. So with me today, joining us today, is Dr. Raina Gupta, neurologist with the Advocate Medical Group of Illinois Masonic Medical Center. And our show is a live show. The number's at the bottom of your screen. If you have any questions for Dr. Gupta, please give us a call. Dr. Gupta, we talked on the experience in the emergency room and so on. So I know that they do all these screenings, they do all these tests and so on. So let's say that you are a candidate for an intervention, obviously, and now you're admitted. What happens?
Well, we do have one very promising intervention. It's called TPA. It's given intravenously, and TPA stands for Tissue Plasminogen Activator. It's also known as a clot buster medication. And basically, because we know that most strokes are blood clots or a lack of blood flow in a blood vessel in the brain, we know that this medication, if given within 4.5 hours of symptom onset, can have the potential to reduce the stroke symptoms or even reverse the stroke and reduce disability or some long-term symptoms from stroke. But like I said, the time window that we have is really only 4.5 hours. This is FDA approved to be given within 3 hours. After the IV medication window, we have other treatment options, which include intervention by a specialist that does the procedure that can cause or can, I guess, cause it or add a catheter and go up to the brain and actually remove the clot physically by mechanical means.
So, but it's my understanding too that generally only 3 to 5% of those who suffer a stroke who reach the hospital in time could be considered for this treatment.
Right. Not everyone is a candidate for the treatment. There are very strict exclusion and inclusion criteria because we want to help more than hurt, and some patients do not benefit from this treatment. So we have to do prior screenings to understand if this treatment is right for the patient, as well as know for sure what time the stroke symptoms started. So it's very important to know the time of onset or the last time the patient was seen normal. And usually we need collateral history, so we need patient's family members or coworkers or someone that was with the patient to come with them to the emergency department to help us understand if the patient might be a candidate for this treatment.
So obviously if someone is complaining of having pain of the left arm, which could still be a heart attack and not necessarily a stroke or both, it really is vital. That time frame is so vital. Don't put it off. Don't sit back. Don't take a Tylenol. Don't take a hot bath. Go to the emergency room. Call 911, and don't drive yourself, most importantly.
Yes, don't drive.
So, Dr. Gupta, you mentioned a little bit about reversing a stroke. So what can be done to reverse a stroke? I mean, can it really be reversed?
So in the short term, like we talked about, IV TPA, which is given through an intravenous line, can be given. There's also an 8-hour window for the mechanical thrombectomy. And even if you don't come to the emergency department immediately, or if you wake up with a stroke and you don't know what time it started, you should still be evaluated by a physician because we have therapies and even rehabilitation that has the potential to improve stroke symptoms after it happened. Stroke patients have the potential to improve symptoms all the way up to a year after a stroke. So there's a lot of potential to improve function and symptoms after a stroke.
So after you've had a stroke, I mean, how often, or is it rare? Do you get another stroke shortly thereafter, or is it something that does reoccur?
It can reoccur. Like we talked about earlier, your risk for a repeat stroke increases significantly, and there are medications that we can use to decrease your overall risk for stroke. So these, you should be evaluated by a physician for these. But on the average, about 25% of patients have another stroke within 5 years, and even 14% of patients have another stroke within 1 year. So it's very important to be evaluated quickly so that we can reduce your future risk for stroke.
And Dr. Gupta, with a candidate, you had mentioned that if they don't get to the hospital in time, within that time frame, the treatment that's available. So if they don't make it on time, this treatment's not available. So it's just rehab?
And therapies. There's plenty of therapies. There's physical therapy, occupational therapy, speech therapy, and rehab, which can be done inpatient or subacute. There's different forms of rehab. But all of these therapies have the potential to improve stroke symptoms. And then a physician's evaluation and or change in medications has the ability to prevent future strokes.
I do want to remind our viewers that Raina Gupta, neurologist, advocate, medical group, on staff over at Illinois Masonic Medical Center. Her office is located at 3000 North Hosted Street in Suite 703 here in Chicago. And if you have any questions, or because you didn't get a chance to call here during the show, give her a call. Area code 773-296-6666. Again, that number is 773-296-6666. Dr. Raina Gupta with Illinois Masonic and Advocate Medical Group. So, Dr. Gupta, a lot of times when you're in the hospital and everyone's around you, things are happening, people mention the word prognosis. What's a prognosis?
So prognosis means, I guess, the long-term consequences or how you'll do after you've had this new, I guess, disease or new illness. In general, we talked about how stroke patients have the potential to improve up to a year after a stroke, and all of our therapies and treatments have the potential to increase that. And really, we're talking about quality of life and function. Everyone wants to know what their quality of life will be, if it will be affected. And obviously, strokes can cause weakness, numbness, even paralysis of one side of the body, or difficulty with speech, weakness in the face, difficulty with memory, difficulty with emotions, change in mood, or agitation after a stroke. And all of these things should be addressed by a physician.
And of course, having all this happening to you can lead to a lot of emotional problems.
Definitely. And all of our patients need support after something difficult like this, and we're able to offer that.
So, what might be the warning signs of a stroke? I know we talked a little, you mentioned a few things earlier, but it's just so important that our viewers and everyone should know the signs of a stroke and what are the warning signs, because things do happen before you actually get to that point. What are some of those things?
So a very common warning sign is called a TIA, which stands for transient ischemic attack. And basically, it's a mini stroke. It's also known as a mini stroke. But basically, you have a temporary stroke. So there's a temporary blockage in the blood vessels in the brain, which recovers or resolves on its own. This can often be a harbinger for future stroke or a warning sign that you are at risk for having a future stroke. And it's very common for people to have a full stroke after having a mini stroke or a TIA. So if you do have one of these, it's important that you're evaluated by a physician immediately, as your risk of stroke increases dramatically in the next week to months upcoming. And you're lucky that your symptoms resolve, but it may not be the case next time.
Right. And just because it goes away, as you're saying, doesn't mean that it's not going to continue or come back.
Right.
And the next time, it's not going to be so light.
Yeah, it has the potential to stick or stay and cause long-term symptoms.
Treatments today. You mentioned there are therapies, there are treatments. Can you talk a little bit about some of them?
So the general treatments that we talked about in the acute period are the IVTPA. Then up to 8 hours, there's mechanical thrombectomy, which is removal of the clot. Then after that, we talked about different therapies in terms of rehabilitation, speech therapy, occupational therapy, physical therapy. There's also a lot of research going into future potentials for treatment or reversal of strokes. We're learning more and more about how the brain adapts to these and how we know that the brain has some plasticity or some potential to compensate for deficits that have happened, especially in young, healthy people. As the brain is so vast, there's so much that we still don't understand about it. A lot of the research is being conducted by the National Institute of Neurologic Disease and Stroke, and there's a great deal of time and money being looked into stroke, as we know that this is a significant cause of disability. And if we can give people better function or better quality of life, then the research will show that hopefully in the next few years there'll be more and more treatments available.
Now, in our opening remarks, I mentioned that, they're talking age 20 and over. How did we get to this point where it's just younger and younger? Why?
Well, we do know that in general, risk factors are increasing in young people. More young people are being diagnosed with high blood pressure, with obesity, with sleep apnea. A lot of people are still smoking, excessive alcohol use. All of these can combine to increase your risk of stroke, including diabetes. And it's very important that people have a healthy lifestyle. Diet and exercise goes a long way still. To modify your diet, to treat your already diagnosed illnesses, and to see your doctor regularly to screen for other potential illnesses that may come up along the way.
Well, let me mention to our viewers, too, you mentioned screenings, and as we're moving forward, as well as we're going into our summer health fairs, I do want to remind our viewers that we do have our first annual health fair that's coming up, our community health fair, Saturday, June 15th from 10 to 2 at Continental Furniture at 1921 North Manheim Road in Melrose Park. Quite a few screenings will be available that actually tie into what we're talking about now with blood pressure checks and cholesterol checks and glucose checks, spinal checks, all kids, child ID kits, all kinds of things happening that day. But for those of you who'd like to attend, this is completely free of charge to all attendees. It is limited to the first 200 registered individuals. Come on out and enjoy the day. There's a lot of things going on that day in addition to what I mentioned. A host of different screenings, information, things that we can all use. Very, very important. Dr. Gupta, if you had a magic wand and you can get all your patients to do what they need to do to prevent a stroke or a heart attack, what would you tell them? What would you wish them with?
I would use my magic wand to ask them to see their physician every year, because all of our blood work needs to be done, our cholesterol needs to be checked. Community health fairs like this are an excellent way to check your blood sugar, to check your blood pressure, to check your blood cholesterol, to look for fatty blood, because these are all risk factors that you may not even know that you have. Or carry, and you might have it for months or years before it's even diagnosed or treated, and this can all lead to risk of stroke.
Absolutely. So we encourage you, take advantage of the free screenings at these events with Hispanocare. You can always visit us at www.hispanocare.org and look at our community calendar of events, or in the Illinois Masonic community calendar of events. Go there. You can find out where all our events are taking place this year, where all the free screenings are happening. We're giving out even free diabetic meters for those individuals with high glucose levels. Ask the doctor's booth after you've been tested, and we hope that they're all normal, but in the event they come out a little bit abnormal, we want you to go talk to the doctor. Ask the right questions. Feel free to do that, and that's why this is brought to you. Prevent is the best measure at all possible.
Definitely.
Dr. Gupta, our time here goes by so quickly, and we can sit here and talk about stroke forever. And when you look at this and what's actually happening and what happens within the body, the brain, I'm sitting this close to it, and it's pretty scary, especially when it can be prevented.
It is. Prevention is the key, and like we talked about, screening, seeing your doctor regularly, getting checkups, and your own healthy diet and exercise is really important.
Well, Dr. Gupta and all of you, on behalf of my colleagues at Hispanocare, Advocate Illinois Masonic Medical Center, Gottlieb Memorial Hospital, and Dr. Raina Gupta with Advocate Medical Group, thank you for allowing us to share with you this important information. Thank you for being on this show.
Thank
I hope
you.
You'll join us again soon.
Sure.
We'd love to have you back. Thank you, Illinois Masonic Hospital, for continuing to support affordable, accessible, bilingual, and bicultural health care to Chicago's communities. My name is Lucy Aquino, and I represent Hispanocare at Illinois Masonic Medical Center, and I'd like to thank you for watching Can Cable 21. Until next time, we invite you to stay tuned for more important information to follow. Until next time, look forward to seeing you at the health fairs. Take care.